My story probably begins about 10 years ago with little things. I couldn't lift my right leg up on its own power to climb into the car. I had to assist it by grabbing my pant leg and putting it in, not realizing it was my hip, thinking it was my knee. And of course that got a little worse, got a limp going on, which slowed me down. But it wasn't until several years after that I realized I could not really lift my leg anymore. I mean, at all. There was no more lift. The left leg I could still lift. The right one was done. And I went to my doctor about it, and she did an x-ray, and that's when I discovered it wasn't a knee issue, it was a hip issue. And the hip was bone on bone, with spurs, no less. I'm going, spurs, bone on bone. Tried the physical therapy angle. It was too painful to try and get that joint to even move as arthritic as it was and bone on bone. And from that point on, I progressively got slower. And then the left hip began to have issues as well. And I found out about 2 years after the right one that I had spurs on the left one too. I was like, really? Okay. In that process, I found out that I also had something called connective tissue disorder, which allowed me to do a lot of things as a child that were not beneficial to the hips. You know, like put your feet behind your head, you know, sit like a Indian style, and my knees could actually touch the ground. They're not supposed to. So some of this damage I did on my own. Some of it was just wear and tear.